Health Department investigating tonight after announcing a case of the measles right here in East Tennessee.
The state's public health laboratory confirming that an East Tennessee resident tested positive. We're looking into the response on a state and local level. Here's what we're learning from state health officials in Nashville. It's the state's first measles case of 2019. The state cannot say exactly where in East Tennessee. Also, they're not releasing information about the patient's age or exact condition.
Now, measles typically shows up as a spotty rash starting on the face, spreading across the body. Other symptoms include fever, runny nose, body aches, and white spots in the mouth. Now, the measles virus is highly contagious. It can stay airborne or live on surfaces for up to 20 hours. Also, it can be transmitted by an infected person for about 5 days before a rash appears.
The state health department is urging everyone to ensure they're up to date on their vaccines. Unvaccinated people are at the highest risk of spread. Over the past decade, Tennessee has seen 15 measles cases. And the state says Tennessee has a relatively high rate of vaccinations, but with the virus turning up in at least 20 states, the state's epidemiologist tells us even one case will prompt health officials to raise the alarm.
We take one case really seriously. And so those 1 or 2 cases per year that we have seen, we sort of go wild in a cautionary sense in terms of personally tracking down individuals that we think are high risk, that have been in contact with these cases. We do lots and lots of interviews. We vaccinate close contacts to these cases. So we're very careful and aggressive about doing that.
Now, the CDC has counted at least 555 measles cases across the country in at least 20 states. It is the second greatest number of cases reported in the U.S. since measles was declared eliminated from the U.S. back in 2000.
So why do measles outbreaks still happen in the country? The majority of people who get the disease were unvaccinated, and it's still common around the globe. The CDC points to an increase in the number of travelers who get the virus abroad and spread it into the U.S., also to the spread of measles in the U.S. communities with pockets of unvaccinated people. Now,
last year, for example, the CDC documented outbreaks in New York and New Jersey among Orthodox Jewish communities, and the year before that in a Minnesota Somali American community with poor vaccination coverage.
We also talked today with the head of Knox County's health department.
And Dr. Martha Buchanan could not offer details about the East Tennessee case. Now, we asked her about whether people need to worry now that the virus has turned up in the area.
I think what people need to do is check their vaccination status. If they're not vaccinated, if they're not up to date, they need to get their vaccine. Again, I think this is an opportunity for people to go, oh, well, I've been meaning to get that measles vaccine, I just haven't done it yet. But again, I can't say it enough, it's a safe, very effective vaccine. One dose is about 85% effective. The second dose just kind of boosts that on up there.
Also, we're hearing tonight from local doctors about the measles.
Yeah, Summit Medical Group sharing an interview with Dr. Eric Penniman. The doctor's saying that there's good reason for taking the measles seriously, considering the complications that it can bring.
The problem with the measles is people die from the measles. They can get a chronic brain infection from the measles. So the complications of measles, which is up to 30% of all cases, can be pretty severe.
Dr. Penniman says the first shot for the measles, the MMR, is given around 15 months of age, plus a booster around the 4 to 5 year mark. We've posted more resources on the measles and the response at our website, WATE.com. Just click on the As Seen On section.